Hello everyone, welcome back. This is Dr. Maria Azizian. Today we will be discussing the role of functional medicine in diagnosis and especially in treatment of skin conditions. And skin is the largest organ of our body. And I usually stop here when I say that because I should say the skin is the largest external organ of our body, as the gut is actually the largest organ of our body. And a lot of people don't know that. But the skin is the largest external organ. And of course, this is something that we see. We see our skin every day. And most people, if not all, do pay attention to how their skin looks. There are many skin disorders that are benefited from functional medicine approach. Some, but not limited to, are eczema, psoriasis, contact dermatitis, acne, rosacea, atopic dermatitis that actually falls under eczema, vitiligo, autoimmune skin conditions, and more and more and more. In approach to skin disorders, it is very important to understand that just like a famous metaphor says that your eyes are windows to your soul, in the same way I view the skin. The skin is a window to an inside condition of your body. So it's essentially a window into your almost to a cellular condition, cellular representation and cellular health of your whole organism. So that's why the rash or eczema or whatever the diagnosis is not just that. It's not just the skin diagnosis. There's usually much more to it. And before I delve into how we deal with or how we approach skin disorder in our clinic, I would like to point out that there are, of course, differences on how conventional medicine looks and treats skin disorders and how functional medicine does that. And as you, the viewers of our channel, are educated on that already, I assume. However, it is important to sort of delineate that difference. When we see patients come in, let's say with eczema, which is a very common diagnosis, and we see, of course, more eczema in colder times of the year. It starts in the late fall, or rather flares up in the late fall in many people, and then gets worse in the winter and finally gets better by May. So that's a very common pattern, but there are people who do not follow their pattern and and there are, of course, different types of eczema. I'm just using the most common and basic example here. So when we see a patient with eczema conventionally, so this is a conventional approach. Conventional approach is to tell the patient, oh, your skin needs more moisture, please moisturize it and do it more than once a day, especially if it's in the winter. And then if eczema is bad enough, we do end up prescribing a topical steroid cream. So what's wrong with that approach? By itself, it's not wrong, and especially in the sense of that topical steroid creams are fine and they are very helpful if you use them sparingly, meaning that this is not a chronic cream. So usually in conversation with our patients, I always stress the importance of not doing the topical cream for more than 2 weeks at a time. So I usually tell them, use it twice a day for no more than 2 weeks at a time or less, because you really don't need to finish the whole course if you see the results earlier. However, what kind of approach is that? Is that really a curative approach? And that's where one of my personal dissatisfaction is with conventional medical approach, because I feel that there's so much more that we can gain from the condition of the person's body. And this is a little clue, skin clue that we get. But instead of really looking deeper into that, we are giving this patient a steroid cream and see you later type of thing. And yes, the truth is most people do get better with a topical steroid cream, but is it sustainable? Because what happens that periodically we get a call from patients like that, and of course they need another refill, and we try not to do that, and now we try to delve in a little deeper. So looking at this from functional medicine standpoint, it's almost like putting a band-aid on this problem, because patient comes to you with this condition, and really you're just giving him a band-aid, and sometimes this band-aid could be sustainable, meaning that it could actually work for some time. It's not a quick fix for some patients, so it could work for some time, and people could say, oh wow, I got cured, I got that topical steroid cream and all is wonderful, and it's gone. But usually, unfortunately, this condition does come back, and that's why the conditions that I listed, like eczema, atopic dermatitis, and many rashes, especially autoimmune rashes or contact dermatitis, and other rashes that I didn't mention, such as hives, they do come back because there's something in the body that keeps triggering them. And the goal of the functional medicine provider is to find that trigger, or as we say in functional medicine, to get to the root cause of this problem. And that's where the fun begins, because now you're not just putting a band-aid on the problem, but you're trying to investigate what is happening. Why is this person developing this condition? Why now? And why does it look like this specifically? And of course, it is also important to look, is it a severe manifestation or is it mild? How often does it come on? The history taking in functional medicine is extremely important, because that's really, it's being a detective who is gathering clues to what is going on. Is it something there's a correlation with something? We do, of course, ask lots of questions in our conventional approach as well. However, the more questions you ask, and especially sometimes asking just open-ended questions, the more information we will get from the patient, and the more information could come out that patient didn't even think that it would be related, but in reality there is a causal relationship between this specific something and the onset of this rash. So there is nothing wrong with prescribing topical steroids. However, that is essentially, I look at it as a temporary measure, and if it's possible, I try not to do that. I try to talk my patient out of it, and try to look into the causes of this condition, and basically trying to eradicate this condition. The difference between conventional and functional medicine approach is that in conventional medicine, the doctor treats, and hopefully cures the patient. In functional medicine, it's more of a partnership. Of course, the physician, the nurse practitioner, PA, whoever is seeing the patient, the medical provider, they are there to treat the patient, to make them better. However, it is a complete partnership, meaning that if patient doesn't participate in this partnership, then the results may not be all that satisfying, because there may be no results. And unfortunately, there is no guarantee, because some causes are very hard to find. And in addition, of course, we do need patient not only be fully present and aware, but to be completely compliant with the treatment. Because let's say if somebody comes to us with rosacea, for example, and rosacea has many causes, including, by the way, a genetic causality as well. And the first thing, the simplest thing with a patient like that is, of course, they need to be very, very diligent with their sunscreen. They need to use sunscreen every single day, including in the winter, and including indoors. And by the way, that's a good advice for just anybody who wants to have a good skin and who wants to protect their skin from sunspots, from sun damage, and from skin cancers that are due to the sun, which are basal cell cancers, squamous cell cancers, and more. So, however, back to the patient with rosacea, somebody with rosacea, they do need to use sunscreen. It's really imperative. And if the patient is not using sunscreen, then really at that step, I feel like there is not a partnership. There is more like an old-fashioned medical model when the physician prescribes something and patient uses it, it either works or doesn't work. But in a patient like that, the patient who is non-compliant, it is hard to get to the bottom of things. I mean, we still try, and in both in conventional medicine and of course much more so in functional medicine, try to get to the bottom of it. But if the patient is not into it, so to speak, then you can't really push that on the patient. You try to help as much as possible. So, we would prescribe something specifically for rosacea, but again, if the patient is not using sunscreen, then a lot of other creams will not work, because the moment they go into the sun, they get much redder than an average person just from a very short exposure. Or same happens, for example, basic example was hot showers. Many people say, oh, I have rash in the shower. Well, hot water brings out any rash, so it does stimulate your skin to get hot. So it is something that really nobody can fix, because if you keep showering with very hot water, you will see that rash. And thankfully, that is a transient issue. So I usually try not to get into a lot of conversation with the patient about that, because if somebody really likes hot water, let it be. But of course, yes, hot water brings out all of the rashes. So that's why just decreasing temperature of the water, not too cold, of course, during the winter, that's not realistic, but to have it less hot would definitely help. But those are very minor details. So just to start discussing as to the causes of skin problems from the functional medicine standpoint, well, let's start with number one. Number one is actually gut problems. I know maybe somebody or some of you did not expect me to say that, but gut microbiome. I know those words are becoming more and more popular, but this balance in bacteria of the gut is a huge contributor to, for example, acne, and not only acne, but many other skin conditions. And it can work on many levels. It can work on the level of the breakage in the gut barrier, what we call leaky gut informally, or it can just work on the fact that the gut is not absorbing the nutrients because something is broken with it. And that, of course, brings us back to the diet. But before we get to it, of course, it has to be diagnosed. We need to know that there are serious disbalances of the gut flora, of the gut microbiome, and that, of course, is the place to start. So a lot of times in approach to skin issue, we actually start with that. That's a very big one. The second, another very big one, which a lot of people know of, is food sensitivities. Food sensitivities and food intolerances. And I will, for the sake of this discussion, I will group them together, although their food intolerances and food sensitivities are a little bit different from each other. But for example, for acne, eating sugary foods, eating pizza, for example, you're eating very greasy foods, and unfortunately eating chocolate. Those types of things are not good, because in most people, not everyone, of course, they trigger an acne breakout. And once I attended a very nice dermatology conference where the speaker was a renowned dermatologist whom I respect a lot, and he said that, oh, it doesn't matter what acne patients eat, they can eat pizza, that this is all just, that's not true. And of course that was sort of strange to hear that, but it always proves that we're human. All of us make mistakes, and of course I disagree with that, and not only I, but the science has shown more and more how what we eat is extremely important, especially for our skin. So definitely food sensitivities, and a lot of patients, by the way, know that, because they would say, oh, I ate this chocolate, I was stressed out, I ate this chocolate bar, and then I had a breakout. So food sensitivities probably is not a surprise for many of you. Obvious food sensitivities are something that you have noticed that there is a correlation. In approach to food sensitivities in general, the key in that approach is that many times we don't know our food sensitivities, because what happens as a result of eating certain food doesn't happen right away. It happens later. It can happen next day. So you can have acne due to a certain food that you eat all the time, but you don't know that you're sensitive to it because you don't have immediate symptoms to it. And the symptoms that you have, let's say you have acne, and let's say you have mild bloating and some GI symptoms in addition to it, and you take it that's just normal, that's just the way you are. But that's not the way you are. That's basically your food sensitivity. So that's why a food sensitivity testing plays a big role as well. And of course, food intolerances is something that to be aware of. That is the key in many skin conditions. So the next is micronutrient deficiencies. So those are deficiencies of minerals and vitamins, such as, for example, zinc or vitamin A, B, D, and those are very important because testing for micronutrients is a little bit different it's different from having just a regular serum or your blood tested. Micronutrients is those minerals and vitamins tested inside of the cell. So you really want to have that because that's more precise, that's more accurate that's why it's called micronutrients. And sometimes the data, the number, the value of micronutrient is different than the one from a conventional serum lab. So that is why it is so important to have that tested as well. Zinc is a very big player in skin health and also in hair loss. So it's very, very important to know the zinc value and to take supplements if you need to take zinc supplements. I would like to throw here another little fact that we see it sometimes is actually people who take vitamin B12 too much. There is such a thing that people who essentially overdose on vitamin B12 and they have high vitamin B12 and they can develop all kinds of rashes as a result. And sometimes it's difficult to diagnose because we're so programmed to think that most people are vitamin B12 deficient that we don't think of that somebody could be actually overdosed and to have too high of a level of vitamin B12. So that's also very important. The next one is hormonal cause of skin disorders, and that is we see a lot, of course, in acne, but also I would like to add to it just in general different types of dermatitis, acne, rosacea, and also older people acne, especially in women. You do see postmenopausal or perimenopausal acne, and periodically I see female patients who say to me, oh, I used to have a great skin all of my life, I had a wonderful skin, and now I have all this breakouts and pimples. I thought that that would never happen to me because I never had it as a teenager. So, and those are often they do have hormonal causality to it. And hormonal, I mean androgens, progesterone, estrogen. Those are all important hormones that do play a role, and we do test for that. One of the tests that we use when there's a suspicion for hormonal cause is a Dutch complete test, which is actually a great test to look into that. Another hormonally related is a stress test, which is looks into a level of cortisol, and it reflects your stress level and also looks into your whole hormonal situation right now, because obviously it does change. And a lot of times, well, I should say overwhelmingly frequently, I do see patients who would say to me something that, yes, I've been through a lot of stress, it is a very stressful time for me, or somebody died, or there's illness in the family. I mean, they're big stressors, and that's life. We do unfortunately go through stresses in our lives, and how we deal with them, nobody's always prepared. That's completely human. So, and our body reflects that. Our body reflects these stresses, and stress is not just a word. So stress has a material implication, meaning that stress is not just bad emotions or bad feelings. Stress turns into a certain hormonal changes in your bodies, and those bodies lead to certain diseases and conditions. So that's why management of stress is one of the cornerstones in functional medicine. And you can't really talk to the patient only about medical issues without discussing how to manage stress, because that's truly a biggie. And of course, the last one, which is sort of, I look at it as like a throwaway bucket, is inflammation of the whole body. Like if you have some kind of processes, other processes going on, that your whole body is inflamed for whatever reason, and inflamed, I mean internally, there are certain processes. For example, like inflammation, if you're fighting a cold or fighting some disease, then your skin actually can manifest that as well. So the skin becomes a byproduct of manifestation of those inflammatory processes that are going on in your body. So we see that as well. And usually in that case, the skin rash or whatever skin condition, it is short-lived in most people. Short-lived as long as the inflammatory response subsides and you're back to your regular level. But if you're not, of course, the skin issues may even get worse, unfortunately. So, so these are sort of groups of causes that can lead to skin issues, and the important part is to know where to start. In conversation with the patient, it is important as to where to start, and not to overwhelm the patient, and also listen to the patient to get the clues as to what is going on and where would be the most efficient in terms of the time and financially way to focus on to eradicate this problem, instead of just prescribing topical steroids. Again, I'm not against topical steroids. I prescribe them myself, but I think it's very unsatisfying and very temporary way of helping somebody. So a very exciting topic. So this was just a little overview, because there are just so many skin issues that are addressed with functional medicine in a proper way, as I think. So thank you very much for listening. Until next time.